Vascular pain can be tough to diagnose because it can mimic muscular issues. Here's the story of one woman who found relief when she found Dr. Ali Amin at Penn State Health St. Joseph Medical Center.
I was having really bad pain in my left leg, and basically it was like from the hip.
Pain was slowing Gail Saladay down at work.
It was like the whole leg was in pain on the scale of 0 to 10. It was a 10. It was really bad. I basically forced myself to go to work and walk all the time. Like when I would go to work, I could not walk from the front of the building to the back of the building to my machines without stopping 2-3 times each time because of it hurting so bad.
It wasn't just work though. The pain crippled her time with family too.
We had taken my grandkids down to Philadelphia, down to the old city. And as we're walking, I had to rest like every block. So we didn't get to see as much as we wanted to show them because of me having to rest all the time.
That interrupted trip led her to Dr. Ali Amin.
In her case, what I did was I did an initial ultrasound of her blood vessels, and we measured the blood flow to the leg. And we found out that number one, the blood flow to the left foot and to the left leg was decreased compared to the right side. And number two, when we did the ultrasound of the blood vessel, we found out that she had a narrowing of the blood vessel in her pelvis that was feeding the left lower extremity. So in that case, I told her that there is a blockage there, and most likely this blockage was causing her symptoms. She came to me, and what I discovered was that a blood vessel that goes down in your pelvis that feeds your left leg and your left thigh, she had a significant narrowing in there. In this case, we discovered that that narrowing could easily be treated by putting a stent in, and that's what we did with her. We took her to the procedure room. It's an outpatient procedure where we go in and we don't make any incisions, but we make a tiny hole in the skin. We are able to put a catheter into the blood vessels, and through that catheter, we're able to inject some contrast or dye to look at the blood vessels, and we saw the narrowing. And in her case, the narrowing was significant, meaning it was more than 80%. And we were able to put a short stent in to open up the blood vessels. And at the end, we took pictures to show that the blood vessels essentially were dilated, and we put her on medications to keep the stent open. And she essentially went home the same day. And when I saw her back, she was essentially her pain with walking, which we call claudication, essentially disappeared.
That level 10 pain reduced to 0 with a minor procedure.
If you think about it, think about having a hose, and the hose is you're watering your lawn, and the hose has a kink. What happens when you unkink it? All of a sudden, the water gushes out of the hose. So same thing here. When you put the stent in, essentially the blood flow is increased significantly, and they get immediate relief. So the muscle, when the muscle, as I said before, when they're walking, they get the pain, that pain goes away immediately because now the muscle has the nutrients and the oxygen to be able to contract more. So she's able to walk more without having any pain.
I walked the next day with no problem, no pain, no nothing. It was a miracle. It was amazing.
Dr. Amin adds that one thing that differentiates circulation pain from joint or muscle pain is that if it's circulation pain, it tends to come on with walking or activity because the muscle needs oxygen and nutrients to be able to work.